Hello, Judy. It's good to have you again here with us. And it's been, 2 weeks since we last chatted. And I know we've been
Yeah.
chatting a little bit before recording, and it's been good catching up with you. And I just know how appreciative we are of everybody in the counties and how hard you guys are working. I know with our collaborative team, I've definitely appreciated all the sacrifices you guys are making. But I think for us here in the Abbotsford area community, we're just kind of wondering what the results were from the testing Thursday and Friday and what we're looking at from that.
Mhm, mhm. So we were out in the community last Thursday and Friday. We did a total of 411 tests between the 2 days, which was a good turnout. Weather was not so good one day, better the next day. Out of that group of people that we tested, we had 31 people test positive. 21 of them were people that lived in Marathon County, and the other 10 were people from Clark County.
So that sounds like a whole lot of cases. What is that telling us about COVID? I mean, are things looking up? Are things looking down? What are you seeing here?
Well, the trend that we're seeing across our county, and in fact, really across the state, is cases are increasing at a more rapid rate than they have in the past. It used to be that we would see 10 cases in a week, and now it's more likely that we're seeing 10 cases in a day. So we know that transmission continues to happen, and there are more and more people sick, and there's a lot of people that we're trying to follow up with and help take care of, and we're getting to the point where we're really overloaded. I know Clark County has the same problem. There's just a lot of transmission happening now.
So when you say overloaded, that means you have to focus on some things and kind of let go of other things. What does that look like right now?
Yes. So our first priority is to contact the people that test positive, and that remains our first priority. They need to know that they're infected and that they need to be isolated. Our second priority is to talk to their contacts to let them know that they've had contact with somebody that's positive, and they need to watch for symptoms, and they need to stay home and stay quarantined. What we would do beyond that is we would do daily monitoring. So it would be checking in with people daily to find out what they need to help them, to check on them and make sure that their symptoms are not getting so bad, or if they need more medical care, how to direct them to get that. And we've not been able to follow up with people on a daily basis. So if we've promised somebody we'll call you every day, the reality is right now is we don't have the capacity to do that. We are simply running out of people and time.
And one thing, as you know very well, Judy, we've been having the food events here in Abbotsford through the St. Bernard's Church. And we'll have another one here Thursday from 2 to 4, where we're getting food from the government to give out in box form. And I just encourage people as well to let us know if there's anything that you need help with, whether it be rent assistance or food, or just need some assistance in some way, to call our hotline. And, we can definitely assist that way, because it sounds like the contact nurses is getting harder and harder for you guys to explain and do those things these days.
Yes. And we are working together. You might not see all of us at the food event, but I want people to know that we are working together in order to make sure that where we know that there are resources for rent or food or other medical help, that if you call that number, you're going to be put in touch with somebody that can help you get what you need. So please do use the number.
Yes, and the number is very easy. It's 715-316-9876. 715-316-9876 for the hotline for the Abbotsford Area Collaborative Team. Judy, one thing that a lot of people are frustrated. I think you know this very well. On all sides, people working with it, not, and people just don't know what to think anymore. And I guess I was just wondering if you could just share with us a little bit about what your viewpoint does of this week, getting this test results of over 30 cases in our area, and of course there's been more cases since. Could you share a little bit with us in that way?
Yeah, I share people's frustration. I was telling Father Tim a moment ago that it's been kind of a hard week, and it's only Tuesday, but it's been it's tough to be on this side and see how many people are impacted by this, and see what it's doing to families and people's ability to, go to work and make money together with their friends. It's hard to see people continue to be diagnosed with this and get sick, and it's wearing on all of us, and all of us are having a different experience with this. It's a very trying time. We will get through this, and we'll get through it better together. And so, I do want to encourage people to protect themselves, to do what they can to slow the spread, to use the hotline to ask for what you need, because we've got a ways to go, and we need to work together.
Yeah, I would definitely agree. We got our city siren going off. I think we got a little bit of thunderstorm coming through.
Oh.
One thing I know for me, it really hit home this week because we have another parishioners who got it, and it actually led to me getting tested. On Friday, I came back negative. It's the first time in my life I've been happy to be called negative. I know for me it was very trying, just, looking at all the things I've been doing with the social distancing and not having meetings, not being in anybody else's house, not eating food anywhere else from other than my kitchen. And just the thought of having it, that things are so out there right now. But I know for me, it was very important to get tested just to have an assurance of caution, abundance of caution.
Yeah.
Could you speak to a little bit of people on the fence getting tested, worried about not being able to work in that? Could you just speak to that a little bit? Because I think that's a really important issue.
Yeah. I think if you have symptoms, it's really important to go get tested so that you know what your status is, and if you're sick, you need to stay home to protect other people. The reason that we're doing all of these things, like you talked about, Father Tim, with staying apart and wearing a mask and social distancing, the reason that we're doing that is to protect each other, and testing is part of that. So if you have symptoms, get tested, and think about why we're doing these things. And it's for our families, it's for our kids, it's for our grandparents, it's for our parents, to keep each other safe and healthy.
Yeah. The other thing I wanted to ask is just, for us kind of looking forward, moving forward, where do we see like the most cases coming from? Because there's a lot of information out there that it's from the workplace, or it's from going to church, or it's from going grocery shopping. What do you see as the more risky activities based on the recent data of people who are getting coronavirus? Where are they seeming to get it more likely?
The most risky things that we've been seeing in terms of the cases that we're having is large gatherings where people come together. It could be a backyard party. I know a lot of like the festivals have been canceled, and so it's not always there, but it's the backyard party or the neighborhood party, the graduation party, the retirement party, whatever it is. Those kinds of gatherings where there's lots of people is where we're seeing a lot of transmission. And we're seeing a lot of transmission, particularly in the young adult population. So that 20 to maybe even 40-year-old persons who are going to large social gatherings. That's where we're finding disease spreading.
Now, when you say a large social gathering, as a priest, I kind of wonder if you're talking about like our churches where we're following all the procedures. Would that be what you're categorizing as this, or is it more a different type of social gathering that you're talking about?
It's really a different type of social gathering. It's the gathering where you're not socially distanced. It's the gathering where you sit next to the person. It's the gatherings where you're eating and drinking together, and therefore you don't wear a mask. You're shaking hands, or you're hugging, or you're greeting people close and face to face. Those are the kinds of social gatherings that I'm talking about. It really comes down to masking and keeping that social distance. Those are the best tools we have, and so we need to use them.
Yes. I know there's a lot of people who are just not too sure. I mean, they hear some people say, oh, the virus really isn't that bad. I really wasn't that sick. And then we've had a couple of people die in our community.
Mm-hmm.
What can you tell us about that? And like if someone does get sick or is worried about getting sick, what are ways for them to take care of themselves and things to look at?
Well, they're right. For some people, it's not it's not a terrible disease to have. We have people that report, feeling mild symptoms and getting over it. We've had a couple of people that really didn't have any symptoms and they got through it. On the other end of that spectrum is people that are severely ill and are ill for weeks and weeks and weeks. And then, of course, as you mentioned, we have had death occur from it. So the challenge is you don't know where you're going to fall in that. You don't know if you're going to be a person that has mild symptoms or bad symptoms. You don't know if you give it to your sister, if she's going to have mild symptoms or severe symptoms. So there's a little bit of unknown there, and I want people to proceed with caution. Really think about what they're doing to their family and friends around them if they're the ones giving COVID to someone else.
Do you believe it's important for people to wear masks right now in public?
I absolutely believe in wearing masks. I wear a mask at work. I'm in my office right now by myself, so I can have it off. But as soon as I walk out the door, I put a mask on. I wear a mask when I'm in the grocery store or any other retail place. I've chosen not to go out and eat in restaurants because I can't eat with my mask on. So I believe masking does a lot to help prevent the spread between people.
Now, I notice a lot of people using those disposable ones. I get nervous. It seems like people are reusing the mask over and over and over. What is a good policy with those disposable paper masks? I mean, how often should they be worn? When should people replace? If they're wearing a cloth mask, what should be a good procedure for that?
Mm-hmm. The disposables can be reused, but we recommend that they're put in a paper bag and left to dry for several days, about 5 days actually. A lot of people don't necessarily want to do that. What I like to do is use the cloth masks. And when you have a cloth mask, you want to make sure there's at least 2 layers of fabric on that cloth mask. You can wear it for the day. I have different ones, and at the end of the day, I put it in the laundry. And so the next day I start with a new cloth face mask and proceed through my week that way.
Now, if you're wearing a cloth mask and let's say it gets wet, does that limit the effectivity of the mask?
Getting wet from like rain?
Wet
from
breath or wet from, let's say you're wearing a mask and you get it wet because you're breathing in that. It gets very damp. Does that limit its effectiveness?
Well, if it's getting wet, what it's probably doing is catching the moisture that comes through your breath. That's a good indication that your mask is working, because if it's catching that moisture, the virus is spread by droplets. And so if your mask is catching that moisture, it's going to be catching the droplets that contain the virus. So it's a good sign that you've got a good mask if it's getting damp on the inside.
Okay. But not to worry too much about that then.
No, and then wash it.
Okay. Well, very good. Is there anything else you wanted to share with us this week?
I would like to share with people, again, these are tough times. We will get through this together. We can take care of each other, and ask for what you need. Use our hotline to call and tell us what you need so that we can try to find things for you, and take care of your family by taking care of yourself. Those would be the things I want people to think about and take with them.
Very good. And then, as we said, Thursday from 2 to 4 at St. Bernard's, we'll have our next food event. And we're planning every Thursday here on out for a while. Are there any other big testing opportunities or anything planned at this point?
We don't have anything planned at this point, but if we do plan something different, I will certainly reach out to you and your congregation to get the word out to people.
Well, thank you so much. We really appreciate everything you're doing. We appreciate you taking the time with us, Sue. Thank you very much.
Thank you.